First question out of the gate, I thought I would challenge y'all a little bit. So I know everyone loves select all that applies, especially ones with 8 options. But this is a helpful NCLEX tip. Don't be overwhelmed when you see SATAs, especially ones with this much stuff. Remember, just take it line by line and treat each option as true or false. So let's take a look. The nurse is planning care for several clients on a medical surgical unit. Which of the following tasks should the nurse delegate to the UAP or unlicensed assistive personnel? Okay, so option 1, foot and nail care for a client with diabetes. What do we think? Are we going to delegate this? Yes or no, or true or false? Well, typically when we see foot or nail care, we would think of that as a routine task. But when we look at the circumstance, a client with diabetes, do we still think that that is routine? No. I see Cassie said no, King family, no, Maria. Okay, I agree with you guys, and let's talk about why. So remember, clients with diabetes typically have 2 issues affecting the lower extremities. The first one is issues of circulation or poor perfusion, and then peripheral neuropathy, where they experience numbness, weakness, decreased sensation. So we know they are at very high risk for foot infections and delayed healing to the feet and lower extremities. So the nurse should be the one responsible for foot and nail care, and sometimes we even refer them to podiatry because they are very high risk for, once again, injury, infection, and sometimes if the neuropathy and the poor perfusion is so bad, that can actually lead to amputations for these clients. So it can be a very high-risk task. So I agree with you guys. I'm not going to delegate that. So now let's look at number 2. Assist a client experiencing confusion to the restroom. What do we think about option 2? So assisting somebody to the restroom would be a routine task, and we see they are experiencing confusion. And this is where I would get in trouble as a nursing student. I would see that and I would just go down a rabbit hole. I would think, oh, maybe they're having a stroke. No, guys. Okay, let's just take the option for face value. Let's not add information. There's nothing that says it's new. It seems like this client is stable. So I agree with you guys. I am going to delegate option 2. So option 3, replace the old IV tubing for a client receiving antibiotics. What do we think about that one? I think that one's a little bit easier, huh? So we know that we must change the IV tubing typically every couple of days because we don't want the client to develop infections or complications related to that. But we know if we look at that UAP scope of practice that they cannot administer any medications. And that task requires a lot of clinical judgment. Remember in nursing school how scared you were probably the first time you were trying to prime tubing? We don't want to give clients air embolisms, and we know that, once again, it has a lot of clinical judgment behind that task. I think we can not delegate that. Then option 4, ask a client who recently received analgesics to rate her pain. What do we think about that? So typically, when we ask somebody to rate their pain, that can be part of the vital signs, and that could be a routine task, but once again, we have to look at the circumstances. And this client just received analgesics. So if a client just received pain medication and we're coming back to follow up and assess their pain, we are evaluating care and actually performing a client assessment. So we do not want to delegate that. Y'all are doing phenomenal. Yes, Meg, that's assessment. Very good. So option 5, denture care for a client who requires assistance to feed himself. What do we think? Denture care is just going to be a routine task, oral care. And once again, this is where you could get yourself in trouble and say, oh, well, if they need assistance to feed themselves, maybe they're at risk for swallowing issues. Don't do that. It doesn't say anything about that. They seem stable. So I agree with you guys. We can delegate that. And option 6, assist a client with rheumatoid arthritis and contractures onto the bedpan. Once again, routine task, stable client. I agree with all you guys. And then perform a partial bed bath for a client post-operative day 2 after a hysterectomy. Once again, partial bed bath is a routine task, and this client is 2 days out from surgery, so they should be stable. And then lastly, help a client with peripheral vascular disease put on elastic compression stockings. What do we think about option 8? Do we like option 8? So we know with peripheral vascular disease, you typically have blood pooling, and we need compression stockings to help improve the blood flow back to the heart. So compression stockings are a very, very important intervention. So for these clients, we could let the UAP put on the stockings, but remember, as the nurse, we must come back and evaluate, were they put on correctly? Yvonne, you said don't overthink, and I agree with you. And I will tell you, delegation, I find is one of the topics that people overthink the most on. So very good advice. Okay, so we got them all correct. So awesome job, guys.